Hello, this is Dr. Gay from First Look MRI, and this is an example of a benign finding in the brain MRI we see not infrequently, and it is called a choroid plexus xanthogranuloma, or you can also call it a complex cyst. They may be the same thing, but it is a benign finding related to the choroid plexus. So in this patient, we have a T2 weighted view. The fluid is white here, or really hyperintense on this view. Here it is of low signal or dark in the ventricles. And if we get back to the choroid plexus area, this is in the atria of the lateral ventricle where the choroid plexus sits. The choroid plexus is a vascularized tissue that secretes the CSF, or the cerebrospinal fluid, that surrounds the brain. Well, that tissue sometimes can develop cyst formation, and the cysts can become complex and look just like this. They call it choroid plexus xanthogranulomas. On the right here, we see that this is a little bit of mass effect, so that atrium is expanded. On the left, not so much. On the T2 weighted views, they're almost invisible except for that little bit of mass effect. You can jog right past them. On the T1 weighted views, instead of being really low in signal, they're more intermediate in signal. And the one that really helps a lot is called the diffusion weighted sequence. So this is a diffusion weighted sequence. Typically these xanthogranulomas are hyperintense. On the diffusion weighted sequence, we see the one on the right and left. And again, these are just benign and incidental. We mention them just as an aside, and they rarely cause any problems, but these are called choroid plexus xanthogranulomas. Now for those radiologists watching, this is the ADC map. We see that this is low in signal on this ADC map, and on the diffusion sequence it's hyperintense. Also on the flare sequence, they are variable, but on this patient it is almost iso-intense to the normal brain. So an example of a benign bilateral choroid plexus xanthogranulomas.